The funds have been secured, and for 24 months, construction will take place. I'm talking about the 2 hospitals promised by this government administration. DeAndre Hamilton is in London with Honorable Floyd Hall, Deputy Premier, and Honorable Lilian Boyce, Minister of Health. She talks to both and tells us what's to come in another telephone interview. DeAndre.
We move slightly from one side of the city of London to another, Berwyn, Leighton, Paysmere. At the foot of the London Bridge is where Eversheds and DLP associates are laying out 2 tables of documents as the signing for the Turks and Caicos hospitals draws closer. The legal, financial, and logistics representatives spent the day going over all documents to ensure every iota is intact and as originally agreed. 2 p.m. London time, in walked our Deputy Premier and Minister for Finance, the Honourable Floyd Hall, and Minister for Health and Human Services, the Honourable Dr. Lilian Boyce, ready to hear for themselves if all is well. WIV4 was privy to the conversations which focused on management of the project from this point on. PricewaterhouseCoopers representatives gave cautions, and then the Honourable Hall and Honourable Boyce were taken to the signing room where documents reflective of 2.5 years of research, discussions, and authorizations lay spread out. We have with us right now our Permanent Secretary of the Ministry of Finance, Mr. Delton Jones, who talks to us about the process in this day.
The process represents the culmination of a very robust and thorough tendering process, which addresses a real critical development issue in the Turks and Caicos. We have the prospect of finally addressing in a very sustained way the problem of medical referral and being able to address in a cost-effective way the healthcare needs of our people inside the Turks and Caicos Islands for the most part. And at the same time, we have a very affordable process. The process has been novel in that we have pioneered new concepts in the area of public-private sector cooperation, in the area of healthcare. We're moving just from provision of infrastructure to also clinical care management. So all in all, we're very elated and pleased with what we have accomplished, and I'm sure the people of the Turks and Caicos Islands will be equally pleased with what has come out of the process.
Tomorrow, Wednesday, the signing will take place. All of the dozens of companies involved will ultimately be authorizing the funding, construction, staffing, and management of the Provo and Grand Turk hospitals to the tune of over $100 million. Among the benefits of the project is a streamlining of healthcare costs and closer quality medical care for the people of the Turks and Caicos. For WIV4, I'm DeAndre Hamilton from London.